Listen up, girl. You ghetto nurses need to know your place. Fetch coffee, empty bedpans, and keep your mouth shut. Dr. Marcus Williams' hand flew across Maya Thompson's face with brutal force. Her head snapped sideways. The packed emergency room at Mercy General Hospital in Chicago fell into stunned silence. Before Maya could recover, his expensive Italian shoe connected with her supply cart, sending it careening across the linoleum floor. Medical equipment exploded everywhere, syringes, bandages, medication scattering like debris from a car crash. The 26-year-old black nurse stood frozen, a vivid red handprint blooming across her dark cheek. 50 witnesses stared in horror. Phones emerged from pockets, fingers hitting record. Maya's eyes remained locked on Dr. Williams, unnaturally calm despite the humiliation. She reached into her scrub pocket, fingers closing around something small and metallic. Around them, chaos erupted. Patients gasped. Staff whispered frantically, but Maya just smiled, a quiet, knowing smile. Have you ever witnessed someone make the biggest mistake of their career? The slap had started with something so simple. It began earlier that evening, during a hectic shift. A middle-aged patient, Mr. Rodriguez, was wheeled in with severe abdominal pain. Maya, with her sharp eye honed from 5 years on the floor, reviewed the labs. Dr. Williams, the patient's symptoms suggest acute pancreatitis. Perhaps we should consider an ultrasound before prescribing opioids. Did I ask for your opinion? Dr. Williams snapped, not even looking up from his clipboard. You're a nurse. Stay in your lane. Maya kept her voice professional, steady. Patient safety requires input from the entire medical team. The labs show elevated lipase levels. Listen up, girl. You ghetto nurses need to know your place. Fetch coffee, empty bedpans, and keep your mouth shut. That's when his hand moved. Fast, vicious. The crack echoed through the emergency department like a whip. Now, 30 seconds later, the aftermath was already spiraling beyond control. The digital clock on the wall read 8:47 p.m. Maya's phone buzzed insistently in her pocket. 4 missed calls from the director's office. The emergency board meeting started in 13 minutes. Nursing student Jessica Martinez had her iPhone out, live streaming to Instagram. Oh my God, y'all. Did everyone just see that? This doctor just straight up slapped a nurse. This is Mercy General Hospital, and I am shook. Your Mercy General abuse checked your nurse abuse. This is not okay. The viewer count climbed. 847, 1,231, 1,191. An elderly patient's son had his Samsung Galaxy pointed directly at Dr. Williams. This is going straight to Twitter, Facebook, TikTok, everywhere. That's assault, man. Straight up assault. Maya's cheek throbbed, but she stood perfectly still. Her modest navy scrubs concealed several interesting details. A vintage Cartier watch that had belonged to her grandmother, an heirloom worth more than most cars, a first-class United Airlines boarding pass in her pocket from Chicago to Boston, dated 3 days ago, and tucked discreetly behind her hospital badge, a small Harvard School of Nursing alumni sticker, Class President 2023. Her employee badge, now slightly askew from the impact, showed something most people never bothered to read, a small 5-year service pin despite her young appearance. Maya, honey, just apologize, whispered charge nurse Carmen Rodriguez, tugging at Maya's sleeve. He can make your life a living hell. Trust me, I've seen it happen. Dr. Sarah Carter, an attending physician, stepped closer but kept her voice low. Williams is connected to administration. Don't fight this. It's not worth your career. But other voices were rising. That nurse was just trying to help, called out Mrs. Garcia, a patient waiting for discharge. She didn't do anything wrong. Nursing student Jessica was still live streaming, her voice getting more animated. Y'all, this nurse Maya is literally the best in this whole ER. She saved my patient yesterday when the doctors missed a drug interaction, and this is how they treat her. The viewer count hit 3,200. Security guard Morris Washington approached, his hand resting uncertainly on his radio. Dr. Williams, is everything okay over here? Need me to handle anything? Dr. Williams straightened his expensive tie, his voice carrying that familiar tone of authority. Just a minor disagreement about protocols, Morris. Nurse Thompson here forgot her place in the medical hierarchy. I haven't forgotten anything, Maya said quietly. Her voice was calm, but something in her tone made several people look twice. Dr. Williams' pager started beeping urgently. He glanced at it, then at the growing crowd of onlookers. Phones were everywhere now, recording, live streaming, uploading. 8:52 p.m., 8 minutes until the board meeting. "Look," Dr. Williams said, raising his voice so everyone could hear. "Nurses who don't respect physician authority endanger patients. It's that simple. There's a reason we have hierarchy in medicine." Dr. Peterson, another attending, nodded vigorously. "Exactly right, Marcus. Can't have staff questioning medical decisions. Sets a dangerous precedent." Young resident Dr. Kim shifted uncomfortably but said nothing. The medical students behind Dr. Williams exchanged nervous glances. Maya's phone buzzed again. This time she glanced at the screen. "Emergency board meeting." "Where are you?" "J. Thompson," she typed back quickly. "Slight delay. We'll explain shortly." The response came immediately. "Are you hurt?" "Security just reported an incident in the ER." Maya didn't reply. Instead, she looked around the emergency department, at the patients recording everything, at the staff members choosing sides, at Dr. Williams, who stood there smugly, completely unaware of what was about to unfold. "Maya," charge nurse Rodriguez tried again. "Please just apologize and let's move on. The shift ends in 2 hours." "Actually," Maya said, her voice still unnaturally calm, "I think we need to let this play out." Dr. Williams laughed harshly. "Let what play out?" "You assaulted a physician." "I never touched you," Maya interrupted. "You challenged my medical authority in front of patients. That's professional assault." The livestream viewer count hit 4,100. Comments flooded in faster than Jessica could read them. "Call the police. Sue that doctor. This is 2024, not 1954. Where's hospital security?" Someone tagged the news stations. 8:55 p.m., 5 minutes remaining. Maya reached into her scrub pocket, her fingers closing around the small metallic object, her employee key card. But she didn't pull it out yet. "Dr. Williams," she said quietly, "I think you should know something." "The only thing I need to know," he snapped, "is that you're about to be looking for a new job." "I'm calling the administration right now." He pulled out his phone, started dialing. Maya watched him, that same knowing smile playing at the corners of her mouth. Around them, the emergency department had become a stage, with 50-plus audience members holding cameras, waiting to see what happened next. Her phone buzzed one more time. "Maya, the board is asking for you specifically. We're starting without you if necessary. J. Thompson." This time, Maya smiled openly. 8:58 p.m., 2 minutes until everything changed. Dr. Williams froze, his finger still hovering over his phone screen. Something in Maya's tone made the hair on the back of his neck stand up. "What's that supposed to mean?" he demanded. But his voice had lost some of its earlier confidence. Maya didn't answer. She simply pulled out her own phone and scrolled through her contacts, her movements deliberate and unhurried. 8:59 p.m., 1 minute until the board meeting. Hospital Administrator Patricia Webb came rushing through the automatic doors, her heels clicking rapidly on the linoleum. She'd obviously received multiple calls. Her face was flushed, her usually perfect hair slightly disheveled. "What in God's name is happening down here?" Webb demanded, surveying the chaos. Medical equipment still littered the floor. Phones were pointed in every direction. "The live stream viewer count had climbed to 5,600. "Patricia, thank goodness," Dr. Williams said, relief flooding his voice. "This nurse physically assaulted me and is now making veiled threats. I need her removed immediately and charged with assault." Webb looked between Dr. Williams and Maya, her eyes lingering on the vivid handprint still visible on Maya's cheek. "Dr. Williams, did you strike this employee?" "I defended myself against an aggressive subordinate who was undermining medical authority in front of patients." "She got physical first." "That's a lie," shouted Mrs. Garcia from her wheelchair. "That doctor slapped her for no reason. 40 people got it on video. He called her ghetto and told her to know her place," added the patient's son, still recording. "This is straight-up racism and assault." Webb's face went pale. She pulled out her tablet, fingers flying across the screen. "Security Chief Martinez, please respond to the ER immediately. We have a code gray situation." Dr. Williams straightened his tie smugly. Finally, some proper authority. Within 30 seconds, Security Chief Tom Rodriguez came jogging down the hallway, followed by 2 additional guards. But instead of the relief Dr. Williams expected, Rodriguez looked genuinely worried. "Ms. Webb," Rodriguez said quietly, "I need to speak with you privately. We've got a major problem. Handle the violent nurse first," Dr. Williams insisted. "She's clearly unstable and making threats." Rodriguez glanced at Maya, then back at Webb. His face was pale. "Ma'am, that's exactly what I need to discuss with you urgently." "My 9 p.m. Board meeting officially begins. Maya's phone rang. The ringtone was simple, but the name on the screen made Administrator Webb's tablet nearly slip from her hands. "Dad," Dr. Williams scoffed. "Oh, calling Daddy, how pathetic." "Security, please remove this disruptive individual," Maya answered calmly. "Hi, Daddy. Yes, I'm still in the ER. There's been an interesting workplace incident." Dr. Williams's confident smirk began to fade. "Daddy?" he repeated, his voice suddenly uncertain. The emergency department had gone quiet, except for the soft dings of social media notifications. Jessica's live stream viewer count hit 6,800, comments flooding in faster than she could read them. "No, I'm not seriously injured," Maya continued into the phone. "But we definitely need to discuss hospital policies regarding workplace violence and racial harassment." Webb's tablet chimed with an urgent message. She glanced down, and the color drained completely from her face. She looked up at Maya, then at her tablet screen, then back at Maya. "Oh no," she whispered. "Oh no, no, no." Security Chief Rodriguez stepped closer to Webb. "That's exactly what I was trying to tell you." "Is what?" Dr. Williams demanded, his voice rising to near hysteria. "Would someone please explain what's happening?" "I'm the victim here," charge nurse Carmen Rodriguez suddenly gasped, her hand flying to her mouth. "Maya Thompson." "Wait, your last name is Thompson? As in?" The pieces were falling into place for the nursing staff, but Dr. Williams was still oblivious. "So what if her last name is Thompson?" "There are thousands of Thompsons." "Are you all insane?" Dr. Sarah Carter grabbed Dr. Williams' arm urgently. "Marcus, stop talking right now. Just please stop talking." But Dr. Williams shook her off violently. "No, I want this woman arrested for assault." "Making threats against a physician and disrupting hospital operations," young resident Dr. Kim whispered frantically. "Dr. Williams, maybe we should what? Let nurses run the hospital? Let them attack doctors with impunity?" The medical students behind Dr. Williams were frantically trying to delete their videos, but it was too late. The footage was already spreading across social media platforms. Maya ended her phone call and looked directly at Administrator Webb. "Ms. Webb, I believe you just received a message about the emergency board meeting." Webb nodded mutely, holding up her tablet. The message was visible to everyone nearby. "From Director J. Thompson, please confirm my daughter Maya is safe. Multiple incident reports suggest workplace violence in ER involving family member, your daughter?" Webb whispered, her voice barely audible. Dr. Williams snatched the tablet from Webb's hands, reading the message. His face cycled through confusion, disbelief, and growing horror. "This is impossible," he stammered. "This has to be some kind of sick joke. Thompson's daughter is a doctor in Boston. She doesn't work here. She's not a nurse." "Actually," said Dr. Peterson nervously, "I think I remember hearing something about Thompson's daughter working her way through graduate school." "Shut up, Peterson," Dr. Williams screamed. "You're all losing your minds." Maya pulled her employee badge from her scrubs and held it up. The plastic was slightly cracked from when she'd hit the ground, but the text was clearly readable. Maya Thompson-Johnson, RN, MSN, employee 2001, director's family. "Employee number 1, Dr. Kim whispered. "That's only assigned to immediate family members of senior administration." "I was in Boston," Maya said calmly. "Finished my master's in nursing administration at Harvard last month. Been working here 5 years while completing my degree nights and weekends." Dr. Williams was staring at the badge like it might transform into something else. But you're just a nurse. You can't be, this has to be fake. Someone's playing a prank." "Dr. Williams," said Security Chief Rodriguez finally, "I've been trying to tell everyone. Ms. Thompson-Johnson is listed in our system as a VIP protected family member. Any incidents involving her trigger automatic director notification and emergency protocols." The live stream comments were exploding. "Plot twist of the century. That doctor is so dead. The director's daughter has been working as a nurse? Respect." Someone called out, "This is better than a Netflix drama." 9:03 p.m., board meeting already underway. Maya's phone buzzed with a text. "Conference room A now. Board Chairman Roberts wants a full incident report. Bring witnesses." Dr. Williams was beginning to hyperventilate. "This can't be happening. James Thompson's daughter wouldn't work as a regular nurse. It doesn't make financial sense." "Why doesn't it make sense?" Maya asked, her voice still unnaturally calm. "Because nursing is beneath a director's daughter? Because black women can't have educated families? The questions hung in the air like accusations. Young nursing student Jessica was still live streaming, her voice breathless with excitement. Y'all, this is absolutely unreal. Maya is literally the hospital director's daughter, and she's been working as a regular floor nurse for 5 years. This racist doctor just slapped the boss's daughter thinking she was just some ghetto nurse. Karma. Viewer count, 8,400 and climbing rapidly. Administrator Webb was frantically making calls. Legal department, emergency consultation needed. Yes, immediately. We have a situation involving the director's family, who were 5 p.m., 5 minutes late to the board meeting. Maya's phone rang again. This time she put it on speaker, and a deep, authoritative voice that everyone in administration recognized immediately filled the emergency room. Maya Elizabeth Thompson-Johnson. Conference room A now, and bring whoever witnessed this incident. Yes, sir, Maya replied. I'll be there in 2 minutes. As Maya hung up, she looked around the emergency department. 50 pairs of eyes stared back at her. Phones were still recording. Dr. Williams looked like he might vomit. Dr. Williams, Maya said quietly, I think you should probably call your lawyer. Then she turned to Jessica, who was still live streaming. Would you mind coming upstairs with me? The board will want to hear from witnesses. As Maya walked calmly toward the elevators, her footsteps echoed in the suddenly silent emergency room. Behind her, absolute chaos erupted. Someone get our insurance company on the phone. How did we not know she was Thompson's daughter? 5 years. She's been documenting everything for 5 years. That live stream has 9,000 viewers. Dr. Williams just assaulted the director's daughter on camera. We are absolutely screwed. Dr. Williams sank into a nearby chair, his head in his hands, finally understanding the magnitude of his mistake. 6 p.m. The elevator doors closed behind Maya Thompson-Johnson, daughter of hospital director James Thompson, Harvard-educated nurse administrator, and the woman who had just been publicly assaulted on live stream by a doctor who thought she was just some ghetto nurse. As the elevator climbed toward the executive conference room, Maya finally allowed herself a small, satisfied smile. The board meeting was about to get very interesting indeed. The elevator climbed slowly to the 4th floor, giving Maya 30 seconds to compose herself. Jessica stood beside her, still live streaming to nearly 10,000 viewers, her phone trembling slightly in her hands. Maya, Jessica whispered, I can't believe this is really happening. Are you really the director's daughter? Yes, Maya replied, her voice steady. But more importantly, I'm a nurse who's been documenting workplace harassment for 5 years. The elevator dinged softly as they reached the executive floor. Conference room A, 9:07 p.m. Maya pushed open the heavy oak doors to find 12 board members seated around the polished mahogany table. At the head sat her father, Director James Thompson, his jaw tight with barely contained fury. Beside him, board chairman Robert Mills looked like he'd aged 10 years in the past 10 minutes. Maya, Director Thompson said, his voice carefully controlled. Are you injured? Physically, just a handprint that will fade. Maya touched her still red cheek. Professionally, that remains to be seen. She gestured to Jessica. This is Jessica Martinez, a nursing student. She live-streamed the entire incident to 10,000 viewers and counting. Board Chairman Mills leaned forward. Ms. Martinez, we'll need you to provide testimony. But first, Maya, tell us exactly what happened. Maya walked to the front of the room, Jessica still recording from the corner. Before I begin, I need the board to understand something. Tonight's incident isn't isolated. It's the culmination of 5 years of systematic harassment I've been documenting while working as a floor nurse. She pulled out her phone and connected it to the conference room's projection system. I've been collecting evidence of workplace discrimination, sexual harassment, and racial bias. Dr. Marcus Williams' assault tonight was just the most extreme example. The wall screen lit up with a detailed spreadsheet. Workplace harassment documentation, Mercy General Hospital. 2019-2024, board member Carter gasped audibly. Maya, how long have you been planning this? I wasn't planning anything, Maya replied calmly. I was working as a nurse, earning my master's degree, and documenting violations of federal workplace safety laws. Tonight, Dr. Williams made the choice to escalate from verbal harassment to physical assault. Director Thompson's voice was ice cold. Show them the footage. Maya nodded to Jessica, who stepped forward nervously. I can play the live stream from the beginning, but it's really hard to watch. The audio filled the conference room. Listen up, girl. You ghetto nurses need to know your place. Fetch coffee, empty bedpans, and keep your mouth shut. Then the crack of the slap echoed through the speakers. Several board members recoiled visibly. Board member Williams covered her mouth in horror. Board chairman Mills's face darkened with rage. Jesus Christ, whispered board member Davis. That's assault. Clear documented assault. Maya clicked to the next slide. Legal implications, federal and state violations under Title VII of the Civil Rights Act. Tonight's incident constitutes both racial harassment and workplace violence. The live stream provides irrefutable evidence. Dr. Williams used explicitly racial language, ghetto nurses, before physically assaulting me. Board member Martinez leaned forward. Maya, what are you asking from this board? I'm not asking for anything, Maya replied. I'm informing you of our legal exposure and liability. The next slide appeared. Financial impact analysis. Dr. Williams's assault, witnessed by 50 people and broadcast to over 10,000 viewers, exposes Mercy General to the following risks. The numbers appeared one by one. Civil rights lawsuit, $2.3–5.7 million average settlement. Criminal assault charges, potential federal investigation, medical license review. Dr. Williams faces state board action insurance exclusion. Intentional acts void our liability coverage. Medicare/Medicaid review. Workplace violence triggers federal audit. Joint Commission sanctions. Possible accreditation suspension. Board Chairman Mills was frantically taking notes. What's our immediate liability exposure? Maya clicked again. Social media impact, real time. The screen showed live social media feeds. TikTok, Mercy General racism trending with 47,000 posts. Twitter, hospital tagged 2,147 times in past hour. Instagram, Jessica's live stream shared 1,200 times. Facebook, hospital's page flooded with 1-star reviews as of 9 minutes ago. Maya continued, our social media crisis has reached approximately 150,000 people. The video has been screen recorded and uploaded to multiple platforms. It's beyond our control now. Director Thompson spoke for the first time since Maya began. What do you recommend? Maya's next slide appeared. Immediate response protocol. Phase 1. Dr. Williams must be suspended immediately pending criminal investigation. No severance, no benefits continuation. He assaulted an employee on camera. Phase 2. Hospital-wide policy implementation within 48 hours. Zero tolerance for racial harassment, with body cameras for all high-risk interactions. Phase 3. External audit of our workplace culture by an independent civil rights organization. Full transparency, public reporting. Board member Carter interrupted. Maya, those are significant operational changes. The cost alone, the cost of not implementing them, Maya cut her off, is losing our federal funding. Medicare and Medicaid don't continue relationships with hospitals that tolerate racial violence. She clicked to her final slide. The choice. 2 columns appeared. Option A, comprehensive reform. Immediate suspension of Dr. Williams, $2 to $3 million investment in culture change. External oversight for 24 months. Transparent public reporting, preserved federal funding, $347 million annually. Option B, minimal response legal battles lasting 3–5 years. Estimated costs, $8 to $12 million, possible loss of accreditation. Staff exodus, 23 nurses already resigned. Reputation damage lasting decades. Board Chairman Mills looked around the table. Is there even a choice here? Maya stepped back from the podium. There's always a choice. You can treat tonight as an isolated incident involving a difficult employee, or you can recognize it as evidence of systemic problems that require systematic solutions. She paused, letting the weight of her words settle. But I should mention one more thing. The room fell completely silent. Maya walked to the conference room window, looking down at the parking lot where news vans were already arriving. The nursing student filming tonight, she didn't just stream to Instagram. She was also recording for a documentary project about workplace racism in healthcare. Board member Davis went pale. A documentary? Harvard Medical School's Department of Social Medicine. They've been following my experience as part of a longitudinal study on discrimination in hospital settings. Tonight's footage will be included in their report to the Department of Health and Human Services. Director Thompson closed his eyes briefly. Maya, why didn't you tell me? Because you need to see how staff treat people they think have no power. If everyone knew I was your daughter, they would have behaved differently. The harassment would have been hidden, not eliminated. Maya turned back to face the board. Dr. Williams thought he was slapping just some ghetto nurse. Instead, he assaulted the director's daughter on camera while being recorded for a federal research study. The irony is perfect. Board Chairman Mills stood up slowly. Maya, what do you need from us? Full implementation of Option A tonight. Dr. Williams terminated before he leaves the building. And my promotion to Chief of Quality Assurance effective immediately. That's a significant promotion. Board Member Martinez began. I have a master's from Harvard, 5 years of documentation experience, and intimate knowledge of our systemic problems, Maya interrupted. Plus, I just saved you from a federal investigation by providing the solution instead of just the evidence. She smiled that same quiet, knowing smile that had unsettled Dr. Williams. The question isn't whether I'm qualified. The question is whether you're ready to fix this hospital or lose it. Board Chairman Mills stood at the head of the conference table, his voice carrying the weight of absolute authority. All in favor of Maya Thompson-Johnson's immediate promotion to Chief of Quality Assurance and full implementation of Option A? 12 hands rose without hesitation. Motion carried unanimously. Mills turned to Maya. You have complete board authority to implement these protocols hospital-wide. What do you need? Maya pulled out a thick folder from her bag, clearly prepared long before tonight's incident. I've been ready for this moment for 2 years. Every policy, every procedure, every legal framework, it's all here. She distributed copies around the table. Phase 1 begins now. Dr. Williams's termination must happen before he leaves the building tonight. Our legal exposure increases every minute he remains employed. Director Thompson activated the conference speakerphone. Security, this is Director Thompson. Please escort Dr. Marcus Williams to conference room B immediately. He's to bring nothing from his office. At 15 p.m. Maya opened her laptop and connected it to the larger wall display. A comprehensive presentation appeared. Mercy General Hospital Cultural Reform Initiative, Implementation Timeline. Board members, what you're seeing is a 180-day transformation plan I've developed over 5 years of frontline observation. Tonight's incident simply accelerated our timeline. The first slide detailed immediate financial implications. Phase 1, emergency response, 24 hours, $47,000. Dr. Williams's immediate termination. Crisis communication specialist legal review of all employment contracts. Emergency staff meeting for damage control, Phase 2. Policy implementation, 30 days, $890,000. Body camera system for all clinical areas. Anonymous reporting platform development. Third-party harassment training for 1,200 employees. External civil rights audit, Phase 3. Culture transformation, 180 days, $2.1 million. Comprehensive bias training program. Patient safety integration protocols. Community oversight board establishment. Long-term monitoring and compliance systems. Board member Davis whistled softly. $3 million total. That's a significant operational expense. Maya clicked to the next slide. Cost of inaction, conservative estimates. The numbers were staggering. Immediate legal exposure, $5.7 million average settlement for documented racial assault. Federal investigation costs, $1.2 million in legal fees. Compliance reviews insurance premium increases, $340,000 annually for 5 years. Reputation damage, 15-30% patient volume loss, $104 million revenue impact. Staff turnover, $3.2 million in recruitment and training costs. Regulatory sanctions, potential loss of $347 million in federal funding. The choice, Maya said quietly, is spending $3 million to fix our problems or losing potentially hundreds of millions by ignoring them. Board Chairman Mills was already reaching for his phone. Legal department, emergency consultation needed. We're terminating a physician for cause tonight. Yes, tonight, at 18 p.m. A knock at the conference room door interrupted the meeting. Security Chief Rodriguez entered with Dr. Williams, who looked disheveled and confused. You wanted to see me? Dr. Williams asked, his voice shaky. Then he saw Maya at the front of the room. What is she doing here? This woman assaulted me. Director Thompson stood slowly, his 6'3" frame imposing in the formal conference setting. Dr. Williams, meet my daughter, Maya Thompson-Johnson, Harvard-educated nurse administrator and your new supervisor. Dr. Williams' face cycled through disbelief, recognition, and growing horror. This is impossible. Your daughter is a doctor in Boston. Was in Boston? Maya corrected. Completing my master's degree while working here full-time. Something you would have known if you'd bothered to treat me as a professional colleague instead of some ghetto nurse. HR Director Lisa Park entered the room carrying a thick personnel file. Dr. Williams, please sit down. We need to discuss your employment status. Dr. Williams remained standing, his voice rising desperately. James, we've worked together for 15 years. This is clearly a misunderstanding. Your daughter attacked me first. Actually, Maya said, activating her phone. Let's review the evidence. The conference room speakers filled with Dr. Williams' voice from the live stream. Listen up, girl. You ghetto nurses need to know your place. Fetch coffee, empty bedpans, and keep your mouth shut. Then the unmistakable sound of the slap. That, said Board Chairman Mills coldly, is racial harassment followed by assault. Both federal crimes. HR Director Park opened Dr. Williams' file. Marcus, you are terminated immediately for cause. Physical assault of a colleague. Racial harassment in violation of our workplace violence policy. You can't do this, Dr. Williams shouted. I'll sue. I'll contact the medical board. You'll what? Maya interrupted quietly. File a complaint about being fired for assaulting the director's daughter on live stream? Please do. The publicity would be fascinating. Maya clicked to a new slide. Dr. Williams' employment consequences, immediate termination effects. Loss of hospital privileges at all affiliated facilities. Mandatory reporting to state medical board. Criminal assault charges filed with district attorney malpractice insurance notification. Potential policy cancellation references marked not eligible for rehire. Additionally, Maya continued, under our updated harassment policy, effective immediately, any physician who fails to report witness discrimination will face disciplinary review. Dr. Williams looked around the room desperately. Peterson, Carter, you know me. This is career suicide over one mistake. Dr. Peterson, who had been silent until now, spoke carefully. Marcus, 47 documented incidents over 3 years isn't one mistake. It's a pattern. Maya's next slide appeared. Systematic Reform Implementation Schedule. Week 1. Emergency Protocols. All department heads complete crisis leadership training. Anonymous reporting system goes live. Body cameras installed in high-risk areas. Staff notification of new zero-tolerance policies. Week 2-4. Comprehensive training. Mandatory bias recognition workshops for all staff. Patient safety integration with respect protocols. Bystander intervention certification. Documentation and reporting procedures. Month 2-6. Culture transformation. Community oversight board establishment. Patient satisfaction integration with staff behavior. Performance review modifications to include respect metrics. External Audit and Public Reporting Systems Board member Martinez raised her hand. Maya, this is extremely comprehensive. How do we ensure compliance? Maya smiled. Simple. Compliance is tied to everything that matters to hospital staff. Performance reviews, promotion eligibility, annual bonuses, and continued employment. She clicked to the enforcement slide. Compliance Enforcement Framework. 360-degree reviews, including patient and colleague feedback. Anonymous reporting with guaranteed response within 48 hours. Progressive disciplinary action with clear consequences. Public reporting of culture metrics quarterly. Staff will comply because their careers depend on it. Patients will notice because their satisfaction scores will improve. The community will support us because we're demonstrating actual change, not just policy statements. Director Thompson looked at his daughter with obvious pride. Maya, this is remarkable work. How long have you been developing this? 5 years. Dad, every night shift, every weekend. Every time someone assumed I was just a nurse, I was documenting, researching, and building solutions. Maya turned back to Dr. Williams, who was still standing frozen in shock. Dr. Williams, you have 2 choices. Leave quietly tonight with a standard termination package, or fight this publicly and face criminal prosecution, civil lawsuits, and complete destruction of your medical career. I need time to think, he whispered. You have until security escorts you to your car, Maya replied. About 3 minutes, Board Chairman Mills stood up. Dr. Williams, your access cards are deactivated. Security will accompany you to collect personal items only. Any hospital property remains here. As security led Dr. Williams toward the door, he turned back one last time. "This isn't over." Maya's smile never wavered. "You're absolutely right. Your assault trial begins in approximately 6 weeks. The civil rights investigation starts Monday morning, and the documentary featuring tonight's footage premieres at the Harvard Medical School Symposium next month." "Oh," she added as the door closed, "and the nursing staff is planning a celebration party for Friday night. You're not invited." 9:25 p.m. With Dr. Williams gone, the conference room atmosphere shifted from crisis management to strategic planning. Board Chairman Mills looked around the table. "Maya, you have complete authority to implement this plan. What do you need from us?" "3 things," Maya replied. "First, a press conference tomorrow morning announcing our zero-tolerance policy and Dr. Williams' termination. Second, budget approval for the $3 million investment. Third, your commitment to public transparency throughout this process." "Done, done, and done," Mills said immediately. Maya gathered her materials. "Then I suggest we get to work. The overnight staff needs to hear about these changes before the morning news breaks the story." As the board members filed out, Director Thompson approached his daughter. "Maya, I'm proud of you. But I'm also sorry you had to experience this." Maya hugged her father briefly. "Dad, someone had to document the truth. I just happened to be in the perfect position to do it." She looked out the conference room window at the news vans gathering in the parking lot. "Besides, tomorrow morning, every nurse in America is going to see that their dignity matters, that their voices count, that someone will fight for them." Maya smiled. "That's worth 5 years of documentation." The next morning, 6 a.m., Maya stood in the hospital's main conference room facing 847 Mercy General employees assembled for an emergency all-staff meeting. The handprint on her cheek had faded to a light bruise, but she wore it like a badge of honor. Director Thompson stepped to the podium. At 9:47 p.m. last night, Dr. Marcus Williams was terminated for cause following his physical assault of Chief Quality Assurance Officer Maya Thompson-Johnson. A murmur rippled through the crowd. Many staff members were seeing the live stream footage for the first time on the conference room screens. Effective immediately, Thompson continued. Mercy General implements zero-tolerance policies for workplace violence, racial harassment, and discriminatory behavior. Maya took the microphone. Dr. Williams thought he was slapping just some ghetto nurse. Instead, he demonstrated exactly why systematic reform is necessary. She activated the presentation display. Every person in this room, regardless of title, background, or family connections, deserves dignity and respect. These new policies ensure that standard. The immediate changes slide appeared. Slide 1. Body camera integration, starting today. All patient care areas now have optional body cameras available. High-risk interactions, disciplinary meetings, conflict resolution, patient complaints require mandatory recording. Charge Nurse Rodriguez raised her hand. Maya, what defines high risk? Any interaction where power dynamics could enable harassment, physicians disciplining nurses, administrators addressing staff complaints, senior staff training junior colleagues. Maya's voice was steady. If someone feels safer with a recording, they get one. Slide 2, Anonymous Reporting System, Mercy Voice. Maya demonstrated the new smartphone app. Report incidents immediately. Include photo evidence, automatic timestamp, and location tracking. Every report receives a response within 48 hours, guaranteed. More importantly, she continued, bystander reporting is now protected and encouraged. If you witness harassment and don't report it, that's complicity. Nursing student Jessica, who had live-streamed the original incident, stood up. What happens to people who file false reports? Same consequence as filing false police reports, Maya replied. But our data suggests false accusations are less than 3% of workplace harassment claims. The real problem is underreporting, not overreporting. The legal framework. Maya clicked to slide 3. Federal compliance integration. These aren't just hospital policies. We're aligning with Title VII civil rights requirements, OSHA workplace safety standards, and Joint Commission quality metrics. Dr. Peterson, who had remained silent during last night's confrontation, asked nervously, Maya, what happens to staff who witnessed harassment but didn't intervene? Maya's expression remained neutral. Mandatory bystander intervention training within 30 days. Future incidents require active response, either direct intervention or immediate reporting. She clicked to the next slide. progressive discipline matrix, level 1 violations, microaggressions, bias language, mandatory training, formal apology, 6-month monitoring, level 2 violations, harassment, intimidation, suspension, external counseling, performance improvement plan, level 3 violations, physical contact, threats, immediate termination, criminal referral. Industry blacklisting Dr. Williams' assault was level 3, Maya explained, but the ghetto nurse comment alone would have triggered level 2 consequences. The technology solutions. Maya demonstrated the comprehensive monitoring system on her laptop. AI-powered surveillance detects raised voices, aggressive gestures, and crowd formations. Security receives automatic alerts. Additionally, panic buttons on all staff badges connect directly to security and administration. No more suffering in silence. Dr. Carter raised her hand tentatively. Maya, this seems like extensive surveillance. What about privacy? Patient care areas already have CCTV for safety. We're simply adding behavioral analysis. Maya's tone was matter-of-fact. If you're treating colleagues with respect, you have nothing to worry about. The community oversight slide appeared on the screen. Slide 5, External Accountability Board. Maya stood confidently before the 847 Mercy General employees gathered in the hospital's main conference room, the morning light filtering through the windows. The bruise on her cheek, now a faint shadow, seemed to underscore her resolve. Mercy General will establish ongoing oversight from a coalition of trusted organizations, the Regional Civil Rights Coalition, the American Nurses Association, and patient advocacy groups, Maya announced. We'll publish quarterly reports detailing culture metrics, incident statistics, and improvement measures. Transparency is non-negotiable. She scanned the room, meeting the eyes of nurses, doctors, and support staff. This hospital will become a national model for a respectful workplace culture. Other facilities will study our transformation and will lead by example. Next came the training revolution. Maya clicked to a new slide, comprehensive training schedule. Every employee, physicians, nurses, technicians, administrators, everyone will complete 16 hours of bias recognition training within 45 days. She gestured to the screen, which outlined the curriculum. This program was designed in collaboration with Harvard Medical School's Department of Social Medicine, the same department, documenting workplace racism for a federal research study. Several staff members shifted uncomfortably in their seats, aware that their actions or inactions might have been recorded for that study. Dr. Peterson, the attending who had nodded along with Dr. Williams the previous night, looked particularly uneasy. Patient care quality improves when staff feel respected and safe, Maya continued. These changes don't just protect employees, they enhance patient outcomes and rebuild our hospital's reputation. She moved to the financial reality, displaying a transparent breakdown of costs. Slide implementation costs. Month 1, $890,000 for technology upgrades and initial training. Months 2-6, $1.2 million for ongoing monitoring and external oversight. Year 1 total, $2.1 million investment. Now compare that to the cost of inaction, Maya said, clicking to a stark comparison slide. A single discrimination lawsuit averages $5.7 million. Reputation damage could cost us $52 to $104 million in lost patient volume. Federal funding, $347 million annually, is at risk if we fail to comply with regulations. She paused, letting the numbers sink in. This reform program costs less than one major lawsuit. Dr. Williams' assault could have bankrupted us. The room buzzed with murmurs. Some nodded in agreement. Others exchanged skeptical glances. Maya shifted to immediate results, pulling up real-time data from the first 6 hours since the new policies were activated. Slide early implementation metrics. Anonymous reports filed, 23. Historical incidents being documented. Body camera requests, 47. Staff feeling safer already. Training enrollments, 312. Voluntary early participation. Patient satisfaction calls, 89% positive response to policy announcement. Staff are already using these tools, Maya noted, her voice steady but encouraging. Change is happening right now and you're part of it. She stepped away from the podium, addressing the room directly for the personal accountability segment. Last night, 50 people watched Dr. Williams assault me. 3 spoke up. 47 stayed silent. The room fell deathly quiet. Even the rustle of papers stopped. Under our new policies, those 47 bystanders would face mandatory training and a notation in their performance reviews. Silence in the face of harassment is complicity. She let the weight of her words settle, then softened her tone. But here's what's different now. You have tools, training, and protection. Anonymous reporting, panic buttons, legal backing, administrative support. The next time someone faces harassment, they won't stand alone. Nursing student Jessica Martinez, who had live-streamed the incident, raised her hand. What happens if someone files a false report? Good question, Maya replied. False reports carry the same consequences as filing false police reports. Disciplinary action, up to termination. But data shows false accusations make up less than 3% of workplace harassment claims. The real issue is under-reporting, not over-reporting. Dr. Carter, the attending who had advised Maya to back down the previous night, spoke tentatively. Maya, this feels like extensive surveillance. What about staff privacy? Patient care areas already have CCTV for safety, Maya responded, her tone matter-of-fact. We're adding behavioral analysis to detect raised voices or aggressive gestures. If you're treating colleagues with respect, you have nothing to worry about. This is about safety, not spying. She clicked to the next slide. Progressive discipline matrix. Level 1 violations, microaggressions, biased language, mandatory training, formal apology, 6-month monitoring. Level 2 violations, harassment, intimidation, suspension, external counseling, performance improvement plan. Level 3 violations, physical contact, threats, immediate termination, criminal referral, industry blacklisting. Dr. Williams' assault was level 3, Maya explained. But his ghetto nurse comment alone would have triggered level 2 consequences. She demonstrated the new technology solutions on her laptop. AI-powered surveillance alerts security to raised voices, aggressive gestures, or crowd formations. Panic buttons on all staff badges connect directly to security and administration. No one suffers in silence anymore. Charge nurse Carmen Rodriguez raised her hand. Maya, how do we define high-risk interactions for body cameras? Any situation where power dynamics could enable harassment, Maya answered. Physicians disciplining nurses, administrators addressing complaints, senior staff training juniors. If anyone feels safer with a recording, they get one, no questions asked. The transformation timeline came next. Slide, roadmap to reform. 60 days, first public culture report, patient satisfaction, staff retention, incident stats, full transparency. 6 months. Other hospitals will send delegations to study our model. 1 year. We'll testify before Congress on systemic culture change in healthcare. Maya concluded with a powerful statement, clicking to the final slide, from crisis to leadership. Dr. Williams thought he was putting some ghetto nurse in her place. Instead, he triggered the most comprehensive workplace reform in this hospital's history. She smiled, that quiet, confident smile that had unsettled Dr. Williams. Sometimes, the biggest mistakes create the greatest opportunities for change. 7:30 a.m. As staff filed out to begin their shifts under the new protocols, Maya remained behind, reviewing implementation data on her laptop. Director Thompson approached his daughter. Maya, in 8 hours you've transformed this entire institution. Maya looked up from her screen. Dad, I didn't transform anything. I just gave people the tools to transform themselves. She gestured toward the emergency department, where nurses were already clipping on body cameras and testing the new reporting app. Dr. Williams was never the real problem. The problem was a system that enabled his behavior. Now we have a system that prevents it. Maya closed her laptop. And tomorrow, every healthcare worker in America will know that change is possible. To understand how Maya Thompson-Johnson became the catalyst for Mercy General's transformation, we must rewind 5 years to 2020, when she began her journey as a nurse. It was the height of the COVID-19 pandemic, a time when American hospitals were overwhelmed. Ventilators hummed constantly, PPE was rationed, and healthcare workers were hailed as heroes in public, but often treated as expendable behind closed doors. For 21-year-old Maya, fresh from nursing school at the University of Illinois at Chicago, it was a baptism by fire. Her father, James Thompson, the hospital's director, had offered her a cushy administrative role. You're Harvard-bound, Maya, he said over dinner at their Hyde Park home. You've got the brains and the connections. Why grind it out on the ER floor? But Maya was resolute, her eyes fierce with determination. Dad, if I'm going to lead someday, I need to understand the front lines, the real struggles, not just budget reports and boardroom politics. Nurses see the truth of healthcare. So, against her father's wishes, she started as a floor nurse in Mercy General's emergency department. Her identity as the director's daughter kept under wraps at her insistence. Only HR and the security team knew for protocol reasons. To everyone else, she was just Maya Thompson, bright, eager, and unassuming in her navy scrubs. Her first shift was chaos incarnate. March 2020, patients gasping for air, families barred from visiting, staff stretched to breaking. Maya was assigned to Dr. Elena Vasquez, a seasoned attending who valued nurses' input. You see something, say something, Vasquez told her. But not every doctor shared that philosophy. During a code blue at 2 a.m., Maya noticed a patient's oxygen saturation dropping. Drawing on her training, she suggested adjusting the ventilator settings. Dr. Marcus Williams, already a rising star with a reputation for arrogance, cut her off. Stick to charting, nurse. Leave the medicine to me, the dismissal stung. That night, alone in her small apartment, Maya opened a leather-bound journal and wrote her first entry, March 17, 2020. Dr. Williams ignored my input on patient care. Potential risk to patient safety. Witnesses, Nurse Rodriguez, resident Kim. This journal would become her documentation Bible, a meticulous record of workplace dynamics. As months turned to years, the incidents multiplied. A white male resident was praised for catching a medication error Maya had flagged hours earlier. A doctor smirked, calling her sassy when she advocated for a patient's pain management. Whispers in the break room, she's articulate, for someone from her background. The subtext was clear. Racial and class biases were alive and well. Maya enrolled in Harvard's online Master of Science in Nursing program, balancing night shifts with late-night study sessions. Her journal evolved into a digital database, dates, times, witnesses, and impacts on patient care. She coded entries by type, microaggressions, overt racism, gender bias, building a case study in real time. By her second year, she had documented 23 incidents. She shared anonymized versions with her Harvard professors who saw potential. Maya, one professor said during a Zoom call, adjusting his glasses, this could redefine how we address healthcare disparities. But be careful, power protects itself. She was cautious. She kept her Harvard alumni sticker tucked behind her badge, her grandmother's vintage Cartier watch hidden under her sleeve. To colleagues, she was just Maya, reliable, sharp, but from the South Side, as some whispered, assuming her roots defined her. One night in 2022, the stakes escalated. A young black patient with sickle cell crisis was wheeled into the ER writhing in pain. Dr. Williams dismissed him as drug-seeking. Maya reviewed the labs and pushed back. His pain is real, doctor. The labs confirm a crisis. Hemoglobin's dropping. Williams' eyes narrowed. Don't tell me how to practice medicine, girl. Later in the break room, he muttered to colleagues. These urban nurses think they know everything. Maya, standing unnoticed by the coffee machine, discreetly recorded the exchange on her phone, adding it to her growing file. That night, she drafted her first reform proposal. Mandatory bias training for all staff, tied to performance reviews. But she didn't submit it. Not yet. She needed more evidence, more allies. She confided in charge nurse Carmen Rodriguez, who shared her own stories of being overlooked. They call me the help behind my back, Carmen admitted. Maya listened, her resolve hardening. By year 4, her database contained 147 entries. She presented an anonymized paper at a Harvard symposium titled Systemic Bias in Urban Hospitals. It caught the attention of the Department of Health and Human Services, who invited her to contribute to their longitudinal study on workplace discrimination in healthcare. Her data became part of a federal research project, all while she worked double shifts, saved lives, and watched the hospital hierarchy crush spirits. The previous night, October 11, 2025, Maya had returned from Boston, her MSN complete. She knew change was coming, but hadn't anticipated how explosively it would arrive. Dr. Williams's slap wasn't just an assault. It was the spark that ignited her years of preparation. Back in the present, 7:45 a.m. on October 12, 2025, Maya sat in her new office as Chief of Quality Assurance, meeting with the hospital's legal team. The lead attorney, Karen Mitchell, flipped through Maya's documentation. "This is ironclad, Ms. Thompson-Johnson. Dr. Williams has no case, but he'll fight dirty." "Let him," Maya said, her voice calm but resolute. "It'll expose more of the system's flaws." The press conference was set for 10 a.m. News outlets, CNN, NBC Chicago, even local bloggers, were clamoring for statements. Maya's phone buzzed with messages from nurses across the country. "You're our voice. Keep fighting." As she prepared her remarks, Maya glanced at her journal, now digitized but still open on her desk. 5 years of truth ready to reshape an institution. The ripple effect was just beginning. 10 a.m. The hospital's auditorium, usually reserved for staff training sessions, was transformed into a makeshift press room. Rows of folding chairs were filled with reporters from major outlets: CNN, NBC Chicago, the Chicago Tribune, even a crew from Good Morning America. Cameras flashed like paparazzi at a Hollywood premiere, and microphones clustered on the podium like a swarm of metallic bees. Outside, news vans lined the parking lot, satellite dishes pointed skyward, broadcasting live to millions. Maya stood off stage, adjusting her collar and checking her notes. The faint bruise on her cheek was covered with light makeup, but she chose not to conceal it entirely, a subtle reminder of the cost of silence. Director James Thompson and board chairman Robert Mills flanked her, their expressions a mix of resolve and apprehension. This was Mercy General's first public statement on the scandal, and the stakes couldn't be higher. Director Thompson stepped up to the podium first, his deep voice steady as he addressed the crowd. "Good morning." Last night, Mercy General Hospital took decisive action in response to a disturbing incident in our emergency department. Dr. Marcus Williams was terminated for cause, following his physical assault on a staff member and the use of racially discriminatory language. "This behavior is unacceptable and has no place in our institution or in healthcare." He paused, letting the words sink in. Murmurs rippled through the reporters. "We are committed to fostering a safe, respectful environment for all employees and patients. Effective immediately, we are launching a comprehensive reform initiative to address and prevent such incidents." Thompson nodded to Maya, who approached the podium with calm authority. The cameras zoomed in, capturing her poised demeanor. "I am that staff member, Maya Thompson-Johnson, RN, MSN, and the hospital's new Chief of Quality Assurance. I am also Director Thompson's daughter, though my family connection does not define my role here. For 5 years, I've worked as a floor nurse while earning my master's degree at Harvard, witnessing firsthand the challenges many healthcare workers face." She spoke clearly, her voice carrying the weight of experience. "Last night's assault was not an isolated event, but the culmination of systemic issues, including racial harassment and workplace discrimination. I've documented these patterns extensively, and now, with the board's full support, we are acting decisively." Maya gestured to the screen behind her, where a redacted clip from Jessica's livestream played. The audio was unmistakable. "Listen up, girl. You ghetto nurses need to know your place," followed by the sharp crack of the slap. Gasps echoed through the room. Several reporters covered their mouths in shock. "This is the reality some of our staff endure," Maya continued. "Today, we announce a $3 million investment in reforms, zero-tolerance policies for harassment and violence, body cameras for high-risk interactions, mandatory bias training developed with Harvard Medical School, and an external audit by civil rights organizations. We're also launching an anonymous reporting app to empower every employee to speak up without fear." She outlined the timeline: immediate implementation of body cameras and reporting systems, full training within 45 days, and quarterly public reports on progress. These changes protect our staff, improve patient care, and rebuild trust in Mercy General. Healthcare workers deserve dignity, regardless of title or background. Questions erupted immediately. A reporter from CNN raised her hand first. "Ms. Thompson-Johnson, some are speculating this was a setup to expose the hospital. Can you address that?" Maya met the reporter's gaze evenly. "No, this was not a setup. I've worked anonymously as a nurse for 5 years to understand the front lines, documenting violations of federal laws like Title VII of the Civil Rights Act. The incident escalated unexpectedly, but it highlighted issues we can no longer ignore. Another from the Chicago Tribune. How long has the hospital known about these systemic problems? Why act now? The hospital administration was informed of patterns through my documentation, Maya replied. But last night's public assault, captured on video and viewed by thousands, made inaction impossible. We're acting now because the evidence demands it, and because it's the right thing to do. A local Fox affiliate asked, "What about Dr. Williams' side?" "He's claiming self-defense. We respect due process," Maya said. "But the video evidence speaks for itself. Criminal charges are pending, and our internal investigation is complete." The conference wrapped after 20 minutes, but the storm was just beginning. By noon, Mercy General Reform was trending nationwide on Twitter, now X, with over 150,000 posts. TikTok videos dissecting the clip amassed millions of views, while Instagram reels from nurses shared stories of similar experiences. Finally, someone's fighting back. One viral post read, garnering 50,000 likes. Support poured in from nurses' unions, including the American Nurses Association, which issued a statement. Maya Thompson-Johnson's courage exemplifies the need for nationwide protections. Celebrities like Oprah Winfrey tweeted, "This is why we need change in healthcare. Stand with Maya." Even politicians weighed in. Illinois Senator Tammy Duckworth praised the reforms on MSNBC, calling them a model for the nation. But backlash emerged swiftly. Dr. Williams' attorney, a high-profile Chicago lawyer named Richard Hale, held a counterpresser at 1 p.m. outside his office. "This is a witch hunt," Hale declared to a small group of reporters. "My client acted in the heat of the moment during a stressful shift. Ms. Thompson-Johnson hid her identity to entrap staff, and the hospital's rush to judgment will be challenged in court. We're filing for wrongful termination and seeking $10 million in damages." The statement fueled online debates. Conservative talk radio hosts labeled it woke overreach, while some medical forums grumbled about nurses overstepping. Yet, the overwhelming response was positive. Petitions for federal workplace protections gained 100,000 signatures by evening. Maya monitored the coverage from her new office, her laptop screen divided between news feeds and the Mercy Voice app. She appeared on a local NBC affiliate at 2 p.m., her first TV interview since the incident. "This isn't about revenge," she told the anchor. "It's about preventing the next assault, the next silenced voice. Healthcare heroes, nurses, techs, aides deserve safety." By 3 p.m., her inbox overflowed with messages from nurses nationwide. "You gave me the courage to report my own story. Thank you for showing us we matter." As the day wound down, the first anonymous report came through the new app. A lab technician described a supervisor's repeated sexist comments during shifts. Maya reviewed it immediately, forwarding it to HR with a note. "Investigation starts today. Response within 48 hours." She leaned back in her chair, exhaling. The reforms were alive. The media storm, a double-edged sword, exposing vulnerabilities but also amplifying the call for change. Dr. Williams' lawsuit loomed, but so did the potential for national reform. Maya's 5 years of quiet preparation were now a public force, and the ripple effects were just starting to spread. 2 weeks after the incident, on October 26, 2025, the legal storm broke. Dr. Marcus Williams, through his attorney Richard Hale, filed a $10 million lawsuit against Mercy General Hospital, Maya Thompson-Johnson, and Director James Thompson. The complaint alleged wrongful termination, defamation, and intentional infliction of emotional distress. Hale argued that Williams acted in the heat of a high-pressure ER shift, and that his disciplinary response was misconstrued as assault. The filing claimed Maya's undisclosed identity as the director's daughter was a deliberate ploy to entrap senior staff, framing the incident as a setup to advance her career. The news hit Chicago's airwaves like a shockwave. Local stations looped Hale's press conference, where he leaned into a populist narrative. Dr. Williams is a dedicated physician who made a split-second mistake under stress, Hale told reporters outside the Cook County courthouse. This hospital threw him under the bus to appease a social media mob. We will fight for justice. Maya, now settled into her role as chief of quality assurance, was unfazed. She met with Mercy General's legal team in a sleek conference room overlooking Lake Michigan. Karen Mitchell, the hospital's lead counsel, spread out the lawsuit papers. They're grasping at straws, Mitchell said, tapping the complaint. The livestream, your documentation, 50 witnesses. This is a losing case. Then let's make it airtight, Maya replied. She pulled up her database, now a 200-entry dossier of workplace incidents spanning 5 years. Williams's pattern of behavior predates me. We countersue for assault, battery, and emotional distress, and we include the hospital's liability for systemic failures that enabled him. By noon, Mercy General filed its countersuit, $5 million for damages caused by Williams's actions, citing reputational harm, staff trauma, and potential federal penalties. The legal team submitted the live stream video, Jessica Martinez's unedited footage, and Maya's meticulously documented evidence of Williams' prior harassment, 47 incidents over 3 years, including racial slurs, intimidation, and dismissing nurses' input. The Cook County District Attorney also acted swiftly, charging Williams with misdemeanor assault and battery based on the video evidence. A separate hearing with the Illinois Medical Board was scheduled to review his license, with a possible suspension looming. The Chicago Tribune ran a headline, "Disgraced Doctor Faces Criminal Charges. License Review After Viral Assault Video." Maya prepared for her deposition in a small law office, her calm demeanor belying the stakes. Under oath, she recounted the incident with precision. Dr. Williams didn't just slap me. He used racial language to demean me in front of patients and staff. This wasn't a one-off. My documentation shows a pattern of discriminatory behavior that endangered patient safety and staff morale. Hale tried to poke holes. Ms. Thompson-Johnson, isn't it true you concealed your identity as the director's daughter to provoke staff reactions? Maya didn't flinch. I worked as a nurse to earn my place, not to provoke. My identity was irrelevant until Dr. Williams made it a weapon by targeting me as just some ghetto nurse. The video speaks for itself. Witnesses bolstered her case. Jessica Martinez, the nursing student who live-streamed the incident, testified tearfully. Maya saved a patient's life the day before by catching a drug interaction. She was professional, and Dr. Williams attacked her for it. Patients like Mrs. Garcia and her son corroborated. He called her ghetto and struck her unprovoked. We saw it all. The judge denied Williams' motion to dismiss, citing overwhelming evidence of intentional misconduct. The trial was set for early December, ensuring weeks of media frenzy. Meanwhile, Mercy General's reforms gained momentum. By late October, body cameras were active in all patient care areas, capturing 2 minor incidents: a doctor raising his voice at a nurse and a supervisor dismissing a tech's safety concern. Both were resolved within 24 hours, formal apologies and mandatory training, demonstrating the system's effectiveness. The Mercy Voice app logged 15 anonymous reports, mostly historical grievances, each receiving a response within the promised 48 hours. Staff morale showed signs of improvement. Nurse retention rates climbed 12%, with 3 nurses who had submitted resignations retracting them after the reforms were announced. I feel seen for the first time, one told Maya during a shift change. But challenges persisted. Some senior physicians resisted the mandatory bias training, grumbling about overreach. At a department heads meeting, Dr. Peterson, who had initially supported Williams, admitted his error. I saw his behavior for years but stayed quiet. I'm sorry, Maya. I'm signing up for the training. Others were less contrite. A group of surgeons circulated a petition claiming the policies undermined medical authority. Maya addressed it head-on in a hospital-wide email. Authority comes from respect, not fear. Non-compliance risks suspension. Let's work together to rebuild trust. The media storm intensified. Maya appeared on Good Morning America, her poised presence captivating viewers. This isn't about one doctor, she told the host. It's about a system that lets harassment fester. Our reforms ensure every healthcare worker, nurse, tech, aide, can work without fear. Her words resonated. The hashtag #MayaLaw trended, with nurses across the U.S. sharing stories of workplace abuse. The American Nurses Association launched a campaign for federal protections, citing Mercy General's model. Even Capitol Hill took notice. Senator Elizabeth Warren tweeted, Maya Thompson-Johnson is leading a revolution in healthcare. Congress must act, but backlash brewed. Conservative outlets like Fox News ran segments questioning the reforms as woke bureaucracy. Online trolls targeted Maya, calling her a diversity hire, exploiting her father's position. She ignored the noise, focusing on data. patient satisfaction up 15%, incident reports down 30%. In her office, Maya reviewed the latest app report. A nurse reported a resident's sexist comment during rounds. She assigned an investigator, ensuring a response by morning. Her phone buzzed with a text from Jessica. "You're changing lives, Maya. Thank you." As November loomed, the legal battle with Williams was just one front. The real fight was sustaining the reforms against resistance, ensuring accountability, and proving that one slap could spark a movement. Maya's 5-year dossier was now a public weapon, and she wielded it with precision, knowing every step forward was a step toward justice for healthcare workers nationwide. 1 month after the incident, on November 12, 2025, Maya Thompson-Johnson stood at the forefront of Mercy General's transformation, but the path was far from smooth. The reforms, body cameras, anonymous reporting, mandatory bias training, were reshaping the hospital's culture, but not everyone was on board. Resistance was brewing, particularly among a vocal minority of senior staff who saw the changes as a threat to their authority. In a packed department heads meeting, Dr. Alan Carter, a veteran surgeon with 20 years at Mercy, presented a petition signed by 15 physicians. "These policies stifle medical decision-making," he argued, his voice tight with frustration. "Body cameras? Anonymous reports? It feels like we're under surveillance, not leadership. We're doctors, not criminals." The room tensed. Several department heads nodded in agreement, while others, including charge nurse Carmen Rodriguez, shifted uncomfortably. Maya, standing at the head of the conference table, listened without interrupting, her expression neutral but attentive. When Carter finished, she stepped forward. "Dr. Carter, I hear your concerns. Let's discuss them openly. These reforms don't undermine medical expertise. They protect the environment where that expertise thrives. Harassment and bias compromise patient care. If a nurse hesitates to speak up because of fear, we all lose." Carter crossed his arms. "And what about false reports? One disgruntled nurse could ruin a career." "The Mercy Voice app has safeguards," Maya replied. "False reports face the same scrutiny as false police reports. Disciplinary action, up to termination. But our data shows underreporting is the issue, not overreporting. Last week, we received 20 anonymous reports. 18 were substantiated historical incidents. This system catches real problems." She projected a slide. Reform impact. Week 4. The numbers spoke clearly. Incident reports down 35%. Voluntary training signups at 450. Patient satisfaction up 18%. These aren't just policies, they're saving careers and improving outcomes. Dr. Peterson, the attending who had initially backed Dr. Williams, spoke up hesitantly. "Maya, I'll be honest. I saw Marcus's behavior for years and stayed silent. I was wrong. I signed up for the bias training yesterday, but not everyone trusts this process yet." His admission broke the tension. Maya nodded. "Thank you, Dr. Peterson. Transparency builds trust. That's why we're publishing our first culture report in 30 days. Every incident, every resolution, fully transparent." But resistance persisted. A group of orthopedic surgeons, led by Dr. Richard Hayes, refused to wear body cameras, calling them invasive. Hayes emailed the board, "These reforms prioritize optics over medicine." Maya responded with a hospital-wide memo. "Compliance is not optional. Non-compliance risks suspension. Let's focus on patient safety, not personal comfort." The pushback wasn't just professional, it turned personal. Maya received anonymous emails through her hospital account. "Troublemaker. You're destroying this hospital." One message, traced to an external IP, called her a diversity hire riding daddy's coattails. She forwarded each to security, who tightened her office access and assigned a guard for her evening shifts. Her father, Director Thompson, pulled her aside after a late meeting. "Maya, I'm worried. These threats, are you sure you're okay?" "Dad, I've been preparing for this for 5 years, she said, her voice steady. Resistance means we're hitting nerves. That's how change works. To counter the opposition, Maya leaned on her allies. Carmen Rodriguez organized a nurse-led support group where staff shared stories of past harassment and brainstormed solutions. Jessica Martinez, the nursing student who live-streamed the incident, became Maya's unofficial assistant, managing the influx of reports and scheduling training sessions. "You changed my life, Maya," Jessica said during a coffee break. "I'm all in." A breakthrough came unexpectedly. Dr. Emily Kim, the young resident who had stayed silent during the incident, approached Maya after a shift. "I regret not speaking up that night," she admitted. "I saw a colleague make a biased comment in rounds today. I reported it through the app. I want to do better. That's all we ask," Maya replied. "Make it right now." The Mercy Voice app logged 50 reports by mid-November, with 5 new incidents alongside historical grievances. Each received a response within 48 hours, with outcomes ranging from apologies to mandatory counseling. The body cameras proved their worth. A recorded argument between a doctor and a tech led to a mediated resolution, preventing escalation. Staff morale was shifting. A nurse named Sarah, who had considered leaving, told Maya, "I stayed because I know someone's listening now." The hospital's retention rate ticked up another 5%, and voluntary training enrollments hit 600, yet Maya knew the battle was ongoing. The looming trial against Dr. Williams, set for December, kept the hospital in the media spotlight. National outlets like CNN and NPR ran features on the nurse who sparked a revolution, but local talk radio stirred dissent, with some hosts calling the reforms overblown PC nonsense. Maya countered with action, not words. She hosted an open forum for staff to voice concerns, addressing skepticism head-on. "Change is hard," she told the crowd, "but silence is harder. We're building a hospital where everyone's voice matters." As November ended, Maya reviewed the latest data. Patient complaints down 20%, staff satisfaction up 15%. The reforms were taking root, but resistance lingered like a stubborn weed. She opened her laptop, adding a new entry to her database. November 12, 2025. Surge in resistance to body cameras. Outcome: policy reinforced, compliance mandatory. Her quiet strength, honed over 5 years, was reshaping Mercy General. One policy, one conversation, one ally at a time. 2 months after the incident, on December 12, 2025, Maya Thompson-Johnson stood in a conference room at Mercy General Hospital, addressing the newly formed Community Oversight Board. The room buzzed with a mix of anticipation and scrutiny. The board, comprising representatives from the Chicago chapter of the NAACP, the American Nurses Association, the Illinois Health and Hospital Association, and local patient advocacy groups, marked a cornerstone of Maya's reform plan, external accountability to ensure lasting change. Maya opened with a data-driven presentation. "In 8 weeks, we've reduced workplace incidents by 40%, increased patient satisfaction by 25%, and boosted nurse retention by 15%, she said, projecting a slide titled Reform Progress, Week 8. "But numbers alone aren't enough. Your role is to hold us accountable, challenge our blind spots, and ensure our commitment to equity isn't just talk." The board chair, Dr. Angela Harris from the NAACP, leaned forward. "Ms. Thompson-Johnson, your reforms are impressive, but transparency is critical. Can you commit to publishing names of staff disciplined for violations?" Maya nodded thoughtfully. "We'll publish aggregated data, incident types, outcomes, and trends quarterly. Naming individuals risks retaliation and legal issues, but will ensure full transparency on systemic patterns. Our first public report drops January 12, 2026. The room nodded in approval, though Harris pressed further. "What about community input? Patients and families need a voice." "Agreed," Maya replied. "We're launching a patient feedback portal next month, integrated with the Mercy Voice app. It'll allow real-time reporting on staff behavior, with responses guaranteed within 48 hours. The meeting adjourned with a commitment to monthly reviews. The board's presence sent a clear message. Mercy General's transformation was under a microscope, not just internally but from Chicago's broader community. Simultaneously, an external audit by the civil rights firm Equity Solutions began. The firm, renowned for its work with urban hospitals, interviewed 200 staff members across departments: nurses, doctors, techs, and custodians. Their preliminary findings, delivered to Maya's office on December 15th, were sobering. While the ER showed significant improvement, the surgical department lagged, with 12 reports of microaggressions and 1 case of overt intimidation by a senior surgeon toward a black resident. The audit recommended targeted interventions, additional bias training for surgeons, mandatory conflict resolution workshops, and leadership coaching for department heads. Maya acted swiftly, scheduling the training for January and assigning mentors to the surgical team. "We can't let any department fall behind," she told her team. "One weak link risks the whole chain. To reinforce accountability, Maya introduced role-playing scenarios in training sessions, simulating real ER and OR conflicts. In one session, a nurse practiced confronting a doctor's dismissive comment while wearing a body camera. The exercise, drawn from Harvard Medical School's curriculum, was a hit. 80% of participants reported feeling more confident addressing bias. Nationally, Maya's model was gaining traction. On December 18th, she received an email from the California Hospital Association. 3 Bay Area hospitals were adopting her body camera protocol, citing Mercy General's success. A week later, the Oregon Health Authority invited her to consult on statewide reforms. "Your data-driven approach is a game changer," their director wrote. Maya flew to Sacramento for a conference call with California hospital leaders, presenting her reform blueprint, Mercy General model. "It's not about punishment, it's about prevention," she told them. "Body cameras deter bad behavior. Training equips staff to act. Transparency builds trust." The call ended with commitments from 5 hospitals to pilot her system. Back at Mercy, the reforms were yielding tangible results. A patient, Mrs. Linda Carter, approached Maya in the ER lobby. "My nurse caught a medication error last week because she wasn't afraid to speak up," Carter said, her eyes welling. "Your changes saved my husband's life." Maya hugged her, the moment a quiet validation of her 5-year mission. But challenges persisted. The surgical department's resistance flared when Dr. Hayes, the vocal critic from November, refused training. Citing scheduling conflicts, Maya issued a formal warning via HR, tying compliance to his annual review. "No one's above the rules," she told him in a private meeting. Hayes grudgingly enrolled. Media coverage remained relentless. NPR aired a segment titled "The Nurse Who Rewrote Hospital Rules," featuring Maya's reforms. The Chicago Sun-Times ran an op-ed praising her data-driven revolution, but warned of pushback from medical lobbies. Social media buzzed. Maya Law hit 200,000 posts on Twitter, now X, with nurses nationwide sharing stories of empowerment. A viral TikTok showed a nurse wearing a body camera, captioned, "Thanks to Maya, I feel safe at work." Yet the spotlight brought scrutiny. A conservative blog accused Maya of weaponizing identity politics, prompting a flurry of hate mail. She filtered it through security, focusing instead on a flood of supportive letters, over 1,000 from healthcare workers across the U.S. One from a Texas nurse read, "You showed me I don't have to stay silent." On December 20th, Maya hosted a hospital-wide town hall, streamed live to staff unable to attend. "We're not perfect yet," she admitted. "But every report you file, every training you complete, makes us stronger. You're the heart of this change." As the year closed, Maya reviewed the latest data. 75 anonymous reports processed, 60% resolved with training or mediation. Patient complaints dropped 25%, and staff satisfaction hit a 5-year high. The audit's final report, due in January, would set the stage for the first public culture report, a milestone that could redefine Mercy General's legacy. Sitting in her office, Maya opened her database, adding a new entry, December 15, 2025. Audit reveals surgical department gaps. Action: targeted training, leadership coaching. The fight wasn't over, but the tide was turning. Her quiet strength, forged in years of documentation, was now a national beacon for change. 3 months after the incident, on January 12, 2026, Maya Thompson-Johnson was reshaping Mercy General Hospital, but the weight of her role as Chief of Quality Assurance was taking a toll. The days were relentless, reviewing anonymous reports, coordinating external audits, preparing for Dr. Marcus Williams's upcoming trial, and fielding media requests from outlets like CNN and the New York Times. By night, she was finalizing the hospital's first public culture report, due for release that day. Sleep had become a luxury, often limited to 4 hours between midnight database updates and early morning strategy sessions. Sitting in her office overlooking Chicago's skyline, Maya rubbed her temples, the faint bruise on her cheek long faded but the memory still vivid. Her phone buzzed with another email, a reporter requesting comment on a rumor that Dr. Williams was planning a tell-all interview. She sighed, adding it to her growing to-do list. The reforms were working, incident reports down 45%, patient satisfaction up 20%, but the personal cost was mounting. Over a quiet dinner at her parents' Hyde Park home, Maya confided in her mother Elizabeth, a retired high school teacher. "It's worth it, Mom, but I'm exhausted," she admitted, pushing her plate of collard greens aside. "Every decision feels like a battle. The hate mail, the resistance, the constant scrutiny, it's a lot." Elizabeth reached across the table, her voice warm but firm. "Your grandmother marched in Selma in '65, facing worse than emails. You're carrying her legacy, Maya. You're building a world where nurses don't have to endure what you did." The words grounded her. Maya's grandmother, a civil rights activist, had gifted her the vintage Cartier watch she wore daily, a reminder of resilience through struggle. Back in her apartment, Maya pulled out her old journal, flipping to an entry from 2020, first shift. "Doctor dismissed my input. Grandma would have told me to keep fighting." She smiled faintly, then closed the book. Her support network became her lifeline. At the hospital, charge nurse Carmen Rodriguez organized a weekly nurses' circle, where staff shared experiences and strategized solutions. Over coffee in the break room, Carmen told Maya, "You've given us a voice, but you don't have to carry this alone. We've got your back." The group's stories of microaggressions, triumphs, and newfound courage recharged Maya's resolve. Jessica Martinez, the nursing student whose live stream had sparked the firestorm, stepped up as Maya's unofficial assistant. Between classes, Jessica sorted reports, scheduled training sessions, and even managed Maya's overflowing inbox. "You changed my life," Jessica said one afternoon, handing Maya a latte. "I was scared to speak up before. Now I'm applying to grad school because of you. Outside work?" Maya leaned on her Harvard classmates, now scattered across the U.S. during late-night Zoom calls. They brainstormed strategies to counter resistance and shared laughs over grad school memories. "You're basically the Aaron Brockovich of healthcare," one friend teased, prompting a rare laugh from Maya. A new spark emerged in her personal life, a budding romance with Dr. Emily Kim, the resident who had stayed silent during the incident but was now a vocal advocate. Over dinner at a cozy West Loop restaurant, Emily opened up. "I regret freezing that night," she said, her eyes earnest. "I was scared of rocking the boat. But watching you, I want to be braver." Maya reached for her hand. "You're making it right now." That's what counts. Their connection, tentative but growing, offered Maya a rare space to be vulnerable, away from the hospital's pressures. To cope, Maya carved out small rituals. Early mornings, she practiced yoga in her living room, the Chicago skyline glowing through the window. Evenings, she journaled, turning stress into strategy. One entry read, January 10th, 2026. Received 5th threat this week. Response forwarded to security, doubled down on reforms. Writing transformed pain into purpose. At the hospital, the reforms gained momentum. The Mercy Voice app processed 90 reports, with 70% resolved through mediation or training. Body cameras deterred 3 potential conflicts, their footage leading to swift apologies. A nurse, Sarah, told Maya, "I spoke up about a doctor's comment yesterday because I knew the app would back me up. But the external pressure persisted." Anonymous threats continued, emails calling her a disruptor or worse. Security traced most to external trolls, but one came from an internal IP, prompting a discreet investigation. Maya shrugged it off publicly, but privately tightened her apartment's security system. The Public Culture Report, released that morning, was a milestone. It detailed 60% fewer workplace incidents, 25% higher staff satisfaction, and 0 Level 3 violations since Dr. Williams' termination. National media praised it. NPR called it a blueprint for healthcare equity. But some physicians' forums grumbled, labeling it performative. Maya responded in a staff memo, "Transparency isn't performance, it's accountability." As January ended, Maya stood in the ER, watching nurses clip on body cameras with confidence. Her phone buzzed with a text from her mother. "Proud of you, baby. Keep going." Maya smiled, her exhaustion tempered by purpose. The trial loomed, but so did the promise of lasting change. Her network, family, friends, colleagues, was her anchor, turning personal toll into collective triumph. 4 months after the incident, on February 12, 2026, the Cook County Courthouse in downtown Chicago became the epicenter of a national spectacle. Dr. Marcus Williams' criminal trial for misdemeanor assault and battery drew overflow crowds. TV cameras from CNN and Court TV and live streams on YouTube reaching millions. The case wasn't just about one slap. It was a referendum on workplace violence in American healthcare. Maya Thompson-Johnson entered the courtroom dressed in a sharp navy suit, her Harvard pin gleaming on her lapel. The gallery was packed, nurses in scrubs, civil rights activists, and curious Chicagoans. Dr. Williams, looking gaunt in a gray suit, sat at the defense table with attorney Richard Hale, who had built his career on high-profile medical cases. Prosecutor Elena Vargas, a no-nonsense veteran, promised irrefutable evidence of assault fueled by racial bias. The trial opened with jury selection. 12 Chicagoans, diverse in age and background, sworn in amid tense silence. Vargas played Jessica Martinez's live stream video as her first exhibit. The courtroom gasped at the audio. "Listen up, girl. You ghetto nurses need to know your place," followed by the crack of the slap. Williams' supply cart kick scattered debris across the screen, captured in crystal clarity. Hale countered weakly. A heated moment in a high-stress ER. No intent to harm, just discipline. But the jury's skeptical glances told another story. Witnesses took the stand. Mrs. Garcia, the patient in the wheelchair, testified. He called her ghetto and hit her like she was nothing. "I've got grandkids her age. This is assault." Her son corroborated, holding up his phone. "I recorded it." Straight up racism. Jessica Martinez, now a full-time nurse at Mercy, fought tears. Maya saved a patient the day before by spotting a drug interaction. She was professional, and he attacked her for speaking up. Hale grilled her. "You live-streamed for views, didn't you?" Jessica shot back. "I streamed for justice." 10,000 people saw the truth. Security Chief Tom Rodriguez detailed Williams's history. 47 documented incidents of harassment. This wasn't isolated, Hale objected. Prejudicial. But the judge overruled. Maya's testimony was the trial's heart. Sworn in, she faced Hale's barrage. "Ms. Thompson-Johnson, you hid your identity as the director's daughter to provoke reactions, correct?" Maya's voice was steel. "No, I worked as a nurse to understand the front lines, documenting 5 years of bias under Title VII violations." Dr. Williams didn't slap a ghetto nurse. He assaulted a colleague, undermining patient safety. His words and actions were intentional racial harassment. Vargas projected Maya's database, 200 entries of systemic abuse. "This pattern endangered lives," Maya said. "Silence enabled it, until the cameras caught it." Hale pressed. "You escalated by challenging his authority." "Patient safety isn't a challenge, it's my duty," Maya replied. The jury leaned forward, captivated. Williams testified last, his voice cracking. "She undermined me in front of patients. I reacted poorly. No racism intended." But cross-examination crumbled him. Vargas replayed the video. "Explain ghetto nurses, doctor," he stammered. Heat of the moment. Closing argument sealed it. Vargas. "This is assault, plain and simple. Racial bias captured on camera." Hale. "A mistake, not malice." After 3 days of deliberation, the verdict came on February 15th. Guilty on both counts. The courtroom erupted. Nurses cheered. Williams slumped. Judge Maria Lopez sentenced him to 1-year probation, 200 hours community service at a free clinic, and a $10,000 fine. "Your actions betrayed your oath," she said. The Illinois Medical Board immediately suspended his license pending a full revocation hearing. Outside, Maya addressed the press swarm. "This isn't victory, it's accountability. Healthcare workers deserve protection from violence." CNN's live feed reached 5 million viewers. Justice for Maya trended with 500,000 posts. The civil suit followed swiftly. In a Cook County bench trial on February 20th, Maya and Mercy General sought $5 million for assault, emotional distress, and reputational damage. Williams countersued for $10 million wrongful termination. Judge Lopez, presiding again, reviewed the evidence. Video, witnesses, Maya's dossier. "Overwhelming proof of intentional misconduct," Lopez ruled. Maya won $2.5 million. Williams' suit was dismissed with prejudice. "No reasonable jury would credit your claims," she added. Maya donated the full amount to the Maya Thompson-Johnson Nursing Scholarship Fund, supporting underrepresented students at Chicago nursing schools. "This money builds the future," she announced at a presser. "No more silenced voices." Media hailed it a landmark. The New York Times front page, "Nurses slap case ushers in healthcare reckoning." Oprah interviewed Maya on her network. "You turned pain into power." Nurses nationwide flooded her with 5,000 letters. "You gave us hope." At Mercy General, reform soared. Post-verdict, anonymous reports dropped 20%. Deterrence working. Body cameras resolved 5 conflicts without escalation. Staff satisfaction hit 92%, a record. But Williams wasn't done. From his suburban home, he announced a tell-all book via Fox News, The Real Story of Hospital Politics. Maya dismissed it. Let him write. The facts speak louder. Privately, with Dr. Emily Kim over dinner, Maya exhaled. It's over, but the work isn't. Emily squeezed her hand. You won for all of us. Maya updated her database. February 15th, 2026. Williams guilty. Reforms validated. The trial wasn't the end, it was acceleration. With Senate testimony looming, Maya's quiet revolution was now a national mandate. 6 months after the incident, on April 12, 2026, Maya Thompson-Johnson stood before the U.S. Senate Committee on Health, Education, Labor, and Pensions in Washington, D.C. The hearing, broadcast live on C-SPAN and streamed to millions, was titled Workplace Safety in Healthcare, Addressing Violence and Discrimination. Maya, now a national figure, was the star witness, her testimony poised to shape federal policy. The chamber buzzed with senators, aides, and reporters, while outside, nurses' unions and activists held signs reading, Maya Law, Protect Healthcare Heroes. Dressed in a tailored charcoal suit, her Harvard pin gleaming, Maya faced the committee, chaired by Senator Bernie Sanders. Her calm demeanor belied the weight of the moment. Behind her, a screen displayed Mercy General's 6-month reform report. Its data a testament to her work. Senators, Maya began, her voice steady. 6 months ago, I was assaulted by a physician in Mercy General Hospital's ER for advocating patient safety. He called me a ghetto nurse and slapped me on camera. That moment wasn't isolated. It exposed a systemic failure in healthcare workplaces. Today, I share how we've changed that system and why Congress must act to protect every healthcare worker. She presented Mercy General's results. Our reforms, body cameras, anonymous reporting, mandatory bias training, have reduced workplace incidents by 89%, increased patient satisfaction by 34%, and achieved 97% nurse retention. We invested $2.1 million and saved $47 million in potential lawsuits and lost revenue. The screen showed a graph, incident reports plummeting, staff satisfaction soaring. This isn't just Mercy General, Maya continued. Our model has been adopted by 127 hospitals in 23 states, from California to New York. Workplace violence is down, morale is up, and patients are safer. Senator Elizabeth Warren leaned forward. Ms. Thompson-Johnson, your data is compelling. How scalable is this model, especially for rural hospitals with tight budgets? Maya nodded. Scalability is built in. Smaller hospitals can use our low-cost Mercy Voice app instead of expensive cameras. We've partnered with tech firms to provide free training modules. The key is culture. Accountability doesn't require millions, just commitment. Senator Rand Paul, skeptical, pressed, aren't these policies overreach? Doctors feel micromanaged by cameras and apps. Respect isn't micromanagement, Maya countered. Our data shows physicians thrive when trust replaces fear. Non-compliant staff face consequences, but 95% of our doctors now support the reforms. They see better teamwork and outcomes. The hearing electrified social media. Maya Law hit 1.2 million posts on Twitter, now X, with nurses sharing stories. I reported harassment today because of Maya. A TikTok montage of body camera successes went viral, amassing 10 million views. CNN's live coverage reached 7 million households, with anchors calling Maya healthcare's new voice. Back at Mercy General, the reforms were entrenched. The latest Mercy Voice app data showed 120 reports processed, 85% resolved through mediation or training. Body cameras deterred 6 incidents, their footage leading to swift resolutions. Patient satisfaction hit 90%, a hospital record, with letters flooding Maya's office. Your changes saved my mom's life. The Senate testimony wasn't just a milestone, it sparked legislative momentum. Senators Warren and Sanders introduced the Healthcare Worker Protection Act, nicknamed Maya's Law, mandating federal standards for workplace safety, anonymous reporting, bias training, and violence prevention protocols. The bill, co-sponsored by 15 senators, cited Mercy General's model as a blueprint. Post-hearing, Maya's documentary, Silent No More, Racism and Violence in Healthcare, premiered at the Harvard Medical School Symposium. Streamed on PBS and YouTube, It drew 4.7 million views in 48 hours, featuring Jessica's live stream footage and interviews with nurses nationwide. Comments flooded in. "This is our story. Thank you." Maya. Her inbox overflowed with 30,000 letters from healthcare workers, nurses, techs, aides, sharing experiences of harassment and empowerment. A California nurse wrote, "I got a promotion because I spoke up, inspired by you." Maya responded to as many as she could, building a national network of advocates. Media amplified her impact. The Washington Post ran a profile. From ER nurse to Senate star, Maya Thompson-Johnson's revolution. Oprah's network aired a special, with Maya saying, "This isn't about me. It's about every worker who's been silenced." Even conservative outlets, initially skeptical, praised the data-driven results. Though some grumbled about government overreach, challenges remained. The American Medical Association lobbied for softer penalties in the proposed bill. Citing physician burnout, Maya met with their leaders, presenting data. Burnout drops when workplaces are safe. They agreed to support a modified version. Back home, Maya updated her database, April 12, 2026, Senate testimony delivered, Maya's Law introduced. In her office, she pinned a new letter to her board from a New York nurse. "You showed us we're not alone." That evening, over dinner with Dr. Emily Kim, now her fiancé, Maya reflected. 6 months ago, I was just a nurse with a database. Now we're changing laws." Emily smiled. "You're changing lives." The ripple effect was unstoppable. Mercy General's model was spreading globally. Canada and the UK requested consultations. Maya's quiet strength, forged in 5 years of documentation, was now a national movement, with Congress as its stage and healthcare workers as its heart. 7 months after the incident, on May 12, 2026, Maya Thompson-Johnson was no longer just the chief of quality assurance at Mercy General Hospital. She was a national figure driving a healthcare revolution. Her reform model, body cameras, anonymous reporting, bias training, and external audits, had transformed Mercy General into a case study for workplace safety. Now, hospitals across the U.S. were clamoring to adopt it. And Maya was on the front lines, consulting, adapting, and overcoming resistance to scale her vision nationwide. Her first stop was New York City, where Bellevue Hospital, the nation's oldest public hospital, faced a crisis eerily similar to Mercy General's. A viral video showed a surgeon berating a black nurse, sparking protests and a staff walkout. Bellevue's CEO invited Maya to implement her model. Over a week in Manhattan, she met with administrators, nurses, and union leaders, tailoring her approach to the hospital's high-pressure urban environment. "Your staff turnover is 22%, she told the board, projecting Mercy General's data. "Our model cut turnover to 3% in 6 months. Invest now or lose millions later." Bellevue adopted body cameras and the Mercy Voice app within 30 days, with Maya overseeing training via Zoom. By June, incident reports dropped 30%, and the hospital issued a press release crediting the Thompson-Johnson model. The New York Times ran a feature. From Chicago to NYC, a nurse's reforms reshape healthcare. Next came Los Angeles, where a coalition of private hospitals faced lawsuits over workplace harassment. Maya flew to California, meeting with the California Hospital Association. She presented a modified blueprint for resource-constrained facilities, open-source reporting apps, virtual training modules, and peer-led workshops. "You don't need millions," she told them. "You need commitment." 5 hospitals signed on, with Cedars-Sinai leading a pilot. Early data showed a 25% drop in staff complaints, echoing Mercy's success. Rural hospitals' Changbi-Sai system. Hospitals posed a unique challenge. Budgets were tight, and high-tech solutions like body cameras were often cost-prohibitive. Maya collaborated with tech firms to develop low-cost alternatives, a streamlined Mercy Voice app with cloud-based storage and free bias training modules hosted on platforms like Coursera. In Montana, a 50-bed rural hospital adopted the app, reporting a 15% increase in staff retention within weeks. It's simple but effective. The hospital's director emailed Maya, "Our nurses feel heard." Challenges emerged in adapting the model to diverse settings. Urban hospitals embraced the tech, but rural facilities resisted external audits, fearing exposure. Maya addressed this in a virtual conference with the American Hospital Association. "Transparency isn't punishment, It's protection, she said. Public reports deter bad behavior and build trust. Her data, Mercy's 89% incident reduction, silenced skeptics. Back at Mercy General, reforms were thriving. The latest report, released May 1st, showed a 92% staff satisfaction rate, 40% fewer patient complaints, and 0 Level 3 violations since Dr. Williams' termination. Maya hosted a staff awards ceremony honoring 20 employees for advocacy, including Jessica Martinez, now a full-time ER nurse. "This is your victory," Maya told the crowd, her voice cracking with pride. But not all news was positive. A false report surfaced via the Mercy Voice app. A nurse accused a colleague of racial bias, later proven baseless. Maya's team investigated swiftly, interviewing witnesses and reviewing camera footage. The accuser received a warning and mandatory training, proving the system's fairness. "False reports are rare but serious," Maya announced in a staff memo. "We protect truth, not agendas." Her national profile soared. TED invited her for a talk in July titled "From Silence to Strength, Reforming Healthcare." She outlined her model to a standing ovation with 2 million livestream viewers. "Change starts with one voice," she said. "Be that voice." Media coverage exploded. NPR's All Things Considered called her healthcare's conscience. Social media buzzed. Maya Law hit 2 million posts, with nurses sharing body camera success stories. But backlash persisted. The American Medical Association published an op-ed warning that overregulation could stifle innovation. Maya responded on MSNBC. "Respect isn't regulation, it's humanity. Personal victories balance the grind." At Mercy, a patient's family gifted Maya a hand-drawn card. "Thank you for making our hospital safe." She pinned it to her office wall beside 5,000 letters from healthcare workers nationwide. Partnerships with tech firms accelerated her impact. Google donated AI tools to enhance the Mercy Voice app's analytics, detecting patterns in harassment reports. Microsoft offered free cloud storage for rural hospitals. These partnerships cut implementation costs by 20%, making the model accessible to underfunded facilities. Resistance wasn't gone. A Texas hospital chain rejected audits citing autonomy. Maya flew to Houston, presenting data. Hospitals avoiding oversight lose $10 million annually to lawsuits. 3 of 5 chains relented, adopting her app. In Chicago, Maya's personal life blossomed. She and Dr. Emily Kim planned their engagement party, a rare moment of joy. Over dinner, Emily said, "You're changing the world." "But you're still my Maya." Maya laughed. Her first real break in weeks. Her database grew, May 12, 2026. National expansion, 200 hospitals committed. Challenges, rural budgets, resistance to audits. In her office, she reviewed a letter from a Mississippi nurse. "Your app saved my career." The momentum was unstoppable. Mercy General hosted delegations from 10 states studying body camera protocols. The Healthcare Worker Protection Act, or Maya's Law, gained 20 Senate co-sponsors. Maya's quiet revolution, sparked by a slap, was now a national blueprint, reshaping healthcare one hospital at a time. 8 months after the incident, on June 12, 2026, Maya Thompson-Johnson's reform model was reshaping American healthcare, with 200 hospitals across 25 states adopting her protocols for workplace safety and equity. But as her influence grew, so did the backlash. Powerful medical lobbies, led by the American Medical Association, AMA, and regional physician groups, pushed back against what they called overregulation and nurse-led overreach, threatening to derail the momentum of Maya's law and her vision for systemic change. The resistance crystallized in a scathing AMA op-ed published in the Wall Street Journal, titled "Healthcare Under Siege: The Dangers of Overzealous Reforms." The piece argued that body cameras and mandatory bias training undermine physician autonomy and create a culture of mistrust. It cited a survey claiming 60% of doctors felt micromanaged by policies like Mercy General's. The op-ed didn't name Maya directly, but referenced a Chicago nurses' crusade, sparking a firestorm. On medical forums like Sermo, where physicians called her reforms anti-doctor, talk radio amplified the narrative. A Chicago-based host on WLSAM labeled Maya's model "woke bureaucracy run amok," accusing her of weaponizing identity politics to vilify physicians. Online, conservative blogs piled on, branding her a diversity darling, exploiting her father's position as Mercy General's director. Trolls flooded her inbox with vitriol. "Go back to the ER, sweetheart." Maya filtered the hate through security, focusing on her mission. She countered the backlash head-on. Appearing on MSNBC's The Rachel Maddow Show, Maya dismantled the AMA's arguments with data. "Physician autonomy doesn't mean unchecked power," she said, her voice calm but incisive. "At Mercy General, our reforms have cut workplace incidents by 90%, boosted patient satisfaction to 92%, and saved $50 million in potential lawsuits." Respect isn't anti-doctor, it's pro-patient. Clips of her interview went viral, garnering 3 million views on YouTube and fueling Maya Law to 2.5 million posts on Twitter, now X. Support poured in from allies. The American Nurses Association, ANA, organized rallies in Chicago, Atlanta, and Los Angeles with nurses holding signs, "Respect, not resistance." The Service Employees International Union, SEIU, launched a petition supporting the Healthcare Worker Protection Act, gaining 150,000 signatures. Even some physicians broke ranks. Dr. Emily Kim, Maya's fiancée and a Mercy resident, wrote an op-ed for the New York Times. "As a doctor, I support Maya's reforms. They make us better, not weaker. Internally." Resistance flared at Mercy General. Dr. Richard Hayes, the orthopedic surgeon who had resisted body cameras, resigned in protest, citing invasive oversight. Maya responded swiftly, hiring a replacement who embraced the reforms. At a staff town hall, she addressed the departure. "Change is hard, but it's necessary. Those who can't adapt to a culture of respect don't belong here." The room erupted in applause, with 80% of staff now fully compliant with training and camera protocols. The Mercy Voice app logged 150 reports, with 90% resolved through mediation or training. A notable case: a nurse reported a surgeon's dismissive comment during rounds. Body camera footage led to a formal apology and counseling. "The system works," Maya told her team, "because it's fair." Nationally, her model gained ground despite the pushback. The California Hospital Association reported 50 hospitals fully implementing her protocols, with a 35% drop in staff turnover. Rural hospitals in Iowa and Nebraska adopted the low-cost Mercy Voice app, praising its simplicity. A Nebraska nurse emailed Maya, "I reported harassment anonymously and got justice." "Thank you," Maya's resilience shone in mentoring. She launched a weekly workshop for young nurses, teaching them to document incidents and advocate. "Evidence is power," she told a group of 20. One nurse inspired reported a colleague's bias, leading to a mediated resolution. Media kept her in the spotlight. Time magazine named her to its 100 most influential list, calling her healthcare's change agent. But the pressure persisted. A late-night call from her mother, Elizabeth, grounded her. "You're doing what's right, Maya. Don't let the noise stop you." In her office, Maya updated her database. June 12, 2026. AMA backlash intensifies. Response: public rebuttal rallied allies. A new letter joined her wall from a Boston nurse. "Your courage saved my career. The fight wasn't over." The Healthcare Worker Protection Act faced Senate debates with medical lobbies pushing amendments to weaken penalties. Maya prepared for another round of testimony, knowing her data, 90% incident reduction, 95% staff satisfaction, would outshine the rhetoric. Her quiet strength, forged in 5 years of documentation, was now a national force, bending even the most entrenched powers toward change. On October 12, 2026, exactly 1 year after Dr. Marcus Williams's assault sparked a revolution, Mercy General Hospital hosted a symposium in its newly renovated auditorium to mark the milestone. Titled From Crisis to Culture, A Year of Change, the event drew 500 attendees, hospital staff, community leaders, and delegates from 15 states studying Maya Thompson-Johnson's reform model. Outside, Chicago's crisp autumn air buzzed with media vans from NBC, CBS, and local outlets, while their Maya Law trended with 3 million posts on Twitter, now X. Inside, Maya stood at the podium, her presence commanding yet reflective, ready to share the journey of the past year. "Good morning," Maya began, her voice steady. "1 year ago, a physician slapped me in our ER, calling me a ghetto nurse. That moment wasn't just personal, it exposed a broken system. Today, we celebrate how we've rebuilt that system, not just for Mercy General, but for healthcare workers everywhere. She projected a slide, 1-year impact report. The numbers were staggering. Workplace incidents down 92%, patient satisfaction up 38%, staff retention at 97%, and revenue up 18% due to a bolstered reputation. We invested $2.1 million in reforms, body cameras, anonymous reporting, bias training, external audits, and saved $60 million in avoided lawsuits and turnover costs, Maya said. This is what accountability looks like. The audience erupted in applause. Nurses like Carmen Rodriguez and Jessica Martinez, now a mentor to new hires, beamed from the front row. A patient, Mrs. Linda Carter, whose husband's life was saved by a nurse empowered to speak up, wiped tears from her eyes. But Maya was candid about challenges. Not everyone embraced change, she admitted. Some physicians resisted and we lost a few. But those who stayed, 95% of our staff, are committed to a culture of respect. She highlighted a recent Mercy Voice app report. 200 incidents processed, 90% resolved without escalation. Every report strengthens us, she said. Nationally, her model was a juggernaut. Over 300 hospitals in 30 states had adopted elements of her blueprint, from urban giants like Johns Hopkins to rural clinics in Idaho. The Healthcare Worker Protection Act, dubbed Maya's Law, passed the Senate with bipartisan support and awaited a House vote. It's not perfect, Maya told the crowd. Funding for rural hospitals remains a hurdle, but we're pushing for federal grants. Media celebrated the milestone. The Washington Post ran a feature, 1 year later, How a Nurse's Courage Changed Healthcare. CNN's Anderson Cooper hosted Maya, calling her a trailblazer for equity. Her TED Talk, viewed 5 million times, inspired nurses nationwide to document their own experiences. Social media buzzed. Mercy General reform hit 4 million posts, with TikToks showing nurses wearing body cameras captioned, "Safe because of Maya." Personal growth defined the year too. Maya had launched the Maya Thompson-Johnson Foundation for Healthcare Equity, funding scholarships for 50 underrepresented nursing students. At the symposium, she awarded the first recipient, a Chicago high schooler headed to Howard University, a $10,000 grant. "This is for every nurse told they don't belong," Maya said, handing over the check. Backlash lingered. The American Medical Association, though softened, still lobbied for weaker penalties in Maya's Law. A few conservative outlets called the reforms overreach, but public support drowned them out. Over 50,000 letters from healthcare workers flooded Maya's inbox. One reading, "You made me believe my voice matters." At a family dinner that evening in Hyde Park, Maya's father, Director James Thompson, raised a glass. "You didn't just save this hospital. Maya, you gave hope to millions." Her mother, Elizabeth, added, "Your grandmother would be so proud." Maya smiled, her grandmother's Cartier watch glinting on her wrist. But the work wasn't done. The Mercy Voice app logged 10 new reports that week, including a surgeon's microaggression caught on camera. Maya's team resolved it with training, but it reminded her, change required vigilance. "Complacency is the enemy," she told her fiancé, Dr. Emily Kim, over coffee. Emily nodded. "You've built a system that fights for itself now." Maya's database, once a private journal, was now a public tool. She updated it. October 12, 2026, 1-year anniversary. Reforms adopted by 300 hospitals. Maya's Law nears passage. A new letter joined her office wall from a Texas nurse. "I reported harassment and won because of you." The symposium ended with a call to action. "This isn't the finish line," Maya told the crowd. "It's a checkpoint. Every hospital, every worker deserves safety and respect. Keep documenting, keep speaking, keep fighting." The standing ovation lasted 3 minutes. As she stepped off stage, Maya glanced at her phone. A text from Senator Elizabeth Warren. "House vote next week. You've changed the game, Maya." Outside, news vans awaited her closing remarks. She stepped into the crisp Chicago evening, her breath visible, her resolve unshaken. One slap had sparked a revolution, and 1 year later, Maya's quiet strength was rewriting the future of American healthcare. 15 months after the incident, on January 12, 2027, Maya Thompson-Johnson stood at a crossroads of global impact. Her reform model, body cameras, anonymous reporting, mandatory bias training, and external audits, had transformed Mercy General Hospital and 350 U.S. hospitals. Now her work was crossing borders. with healthcare systems in Canada, the UK, Australia, and South Africa seeking to adapt the Thompson-Johnson model to their contexts. As Chief of Quality Assurance and a global consultant, Maya balanced international outreach with sustaining Mercy General's gains, all while navigating personal milestones. Her first international engagement came via an invitation from Canada's Ontario Hospital Association. Toronto's St. Michael's Hospital, reeling from a publicized case of physician harassment, requested Maya's expertise. She flew north, presenting her model to a skeptical board. "Our healthcare system is publicly funded," a director noted. "Your tech-heavy approach might not translate." Maya countered with data. Mercy General cut incidents by 92% with scalable tools like our free Mercy Voice app. You can start there. Within 60 days, St. Michael's piloted the app, reporting a 20% drop in staff complaints. Canadian media, including CBC, hailed it as a Chicago nurse's global blueprint. The UK posed a different challenge. The National Health Service, NHS, grappling with nurse burnout and racial bias complaints, invited Maya to London. Cultural differences emerged. British staff viewed body cameras as intrusive due to privacy laws like GDPR. Maya adapted, emphasizing anonymous reporting and virtual training. "Respect is universal," she told NHS leaders. "Tailor the tools to your laws, but don't compromise on accountability." By December, 10 NHS trusts adopted her app, with early data showing a 15% rise in staff morale. South Africa's invitation came next, spurred by a viral video of a Johannesburg doctor berating a black nurse. Maya collaborated virtually with the South African Nursing Council, addressing resource constraints. "Many clinics lack internet," a council member said. Maya partnered with Google to distribute offline-enabled apps, preloaded on low-cost tablets. A Cape Town clinic reported 30 anonymous reports in the first month, resolving 80% through mediation. The Mail and Guardian called her Africa's healthcare hero. Australia's challenge was scale. With vast rural areas, hospitals struggled with connectivity. Maya's team developed a text-based reporting system, accessible via basic cell phones. A Perth hospital adopted it, cutting harassment reports by 25%. The Sydney Morning Herald ran a headline, "American Nurses Reforms Reach Outback." Back home, Mercy General was a beacon. The latest data, presented at a January staff meeting, showed a 95% incident reduction, 98% staff satisfaction, and patient satisfaction at 94%. The Mercy Voice app processed 250 reports with 90% resolved without escalation. Body cameras deterred 10 conflicts, their footage leading to swift apologies. A nurse, Sarah, told Maya, "I challenged a doctor's bias yesterday. The camera backed me up." The Healthcare Worker Protection Act, or Maya's Law, passed the House in November 2026 and was signed into law by President Kamala Harris on December 15th, mandating workplace safety standards nationwide. Maya's foundation, now funding 100 nursing scholarships, celebrated with a gala in Chicago, raising $1 million. She awarded a scholarship to a Navajo student headed to UCLA, saying, "Your voice will shape the future." Media amplified her global reach. The New York Times ran a cover story. From Chicago ER to global stage, Maya Thompson-Johnson's revolution. Her PBS documentary, Silent No More, won an Emmy, reaching 10 million viewers. Social media buzzed. Maya Law hit 5 million posts, with nurses in London and Johannesburg sharing stories. Maya's app gave me courage. But global expansion wasn't seamless. Cultural resistance surfaced in the UK, where some doctors called anonymous reporting un-British. In South Africa, funding shortages slowed tablet distribution. Maya addressed these in a WHO webinar. Adapt the model to your context, but don't dilute the principle. Workers deserve safety. Her flexibility won over skeptics. With 50 international hospitals joining by January, personal milestones grounded her. On January 1st, Maya and Dr. Emily Kim married in a small Chicago ceremony, surrounded by family and nurses. Carmen Rodriguez, now a regional ANA leader, gave a toast. "Maya, you turned pain into power." Maya's mother, Elizabeth, gifted her a framed photo of her grandmother at Selma. Inscribed, "You carry her torch." Challenges persisted. A U.S. physicians group filed a lawsuit against Maya's Law, claiming it stifles free speech. Maya's legal team, led by Karen Mitchell, prepared a robust defense, citing her database, 300 documented incidents resolved fairly. The law protects, not punishes, Maya told CNN. In her office, Maya updated her database. January 12, 2027. Global expansion. 50 international hospitals adopt model. Challenges: cultural resistance, funding gaps. A new letter joined her wall from a London nurse. Your app stopped my harassment. Thank you. At a virtual summit with WHO and UN health leaders, Maya closed with a call to action. Healthcare workers are the backbone of any system. Protect them and you protect patients. The summit, streamed to 20 million, cemented her as a global voice. As January ended, Maya stood in Mercy General's ER watching nurses clip on body cameras with pride. Her phone buzzed. A text from a South African nurse. We're safer because of you. Her quiet strength, sparked by a slap, was now a global movement, reshaping healthcare one voice at a time.